and advise you on Women Radio. The program airs from 10 a.m. Monday through Friday. My name is Ni'matullah Hassan. Today's topic is titled Kidney Failure. We'll discuss what end stage kidney disease means, what treatment options are available, and whether it can be prevented. It's common knowledge that our kidneys work around the clock, filtering waste from the blood, balancing fluids and minerals, regulating blood pressure, and supporting many essential functions in the body. But what happens when the kidneys become severely damaged and can no longer do these functions? A person may develop end stage kidney disease, also known as kidney failure. Join us today. Joining us today is Dr. Olakunle Joshua, a general practitioner who will help us understand this life changing condition. Good morning, doctor. You're welcome to the program.
Good morning. Thank you very much for the privilege to be in this program today.
Okay. So, doctor, what exactly is end stage kidney disease?
End stage kidney disease is irreversible kidney failure. We have different stages of kidney disease. There's the acute phase and there's the chronic phase. So when it
Okay.
comes to the end stage, it simply means it is irreversible. The kidney has no means of performing its functions again.
Okay. Okay. How is it different from chronic kidney disease?
Okay, chronic kidney disease is a progressive kidney disease that has to do with it. Okay, it's characterized by decline in function and
Okay.
structure of the kidney.
Okay.
Now, in chronic kidney disease, it can be reversible. It's a progressive process, while in
Okay.
end stage, it is irreversible automatically.
Okay. Okay. So, for clarity, end stage is as its name implies, but chronic kidney disease is progressive.
Yes, yes.
Okay. Dr. Joshua, do you mind turning on your camera?
Okay.
Your camera is meant to be on. Oh, thank you for that. So this is WFM 91.7. You are listening to Radio Doctor, and the time is 14 minutes past 10 on this beautiful Thursday morning, July 9th, 2026. Okay, doctor, what happens inside the body when the kidneys stop functioning properly?
We have, okay, that will lead us to maybe different types of the functions of the kidney. We have like
Okay,
several functions where what the kidney does to the body. First,
okay,
the kidney helps to control what we call the acid base.
okay,
Then second, the kidney helps to control blood pressure.
okay,
Kidney helps us to filter waste product.
okay.
And also, kidney helps in production of some hormones. So
Many people reach kidney failure without knowing they had kidney disease.
now, many people get down to end stage kidney disease
Okay,
without knowing because some, I would say, due to lack of maybe exposure to or lack of awareness to what
okay,
kidney disease is all about.
okay,
Some, due to lack of routinely check of their kidney function, I always advise people if it's quarterly, it's a very good thing for you to routinely check, especially
okay,
those who maybe have a family background of hypertension, diabetes, and so on, or even the kidney disease. There should
okay,
be a routine check of your renal function test, maybe quarterly or even biannually. Then those some people might not know they have end stage or will not know they have end stage kidney disease if how will I put it now? We find out that so many people are Nigerian setting, we
okay,
go with intake of toxins.
okay,
For instance, drugs such as NSAIDs,
mm-hmm,
ibuprofen, pain, those high pain relief medications. We take them more in order to energize us. We take high
Mm-hmm.
caffeine diet in order to keep us fit for our daily routine works.
Mm-hmm.
And those are not kidney friendly drugs, you understand? So we might not
Okay.
know the thought whether they are doing more good than harm to us. So that can also lead to kidney failure.
Okay. So these toxins you mentioned, are they the only leading causes of kidney failure in Nigeria? Or are there other causes also?
No, no, they are not the leading cause. The
Oh,
major leading cause of end-stage kidney disease in Nigeria is hypertension, but
okay.
worldwide, the leading cause is diabetes.
Okay.
So hypertension, diabetes, infection, recurrent infection. If you don't treat UTI, that's urinary tract infection, it can come down to end-stage kidney disease. Then these toxins, as I said, illicit drugs that are not kidney friendly. Some antibiotics are not kidney friendly, such as gentamicin. NSAIDs such as ibuprofen, diclofenac, that's judiciously use of them are bad to the kidney. Then taking of agbo, those are plants whereby we don't know the actual constituent of them, and we don't know the amount in which our human body can carry and filter. We take it, many people, you go to the park, you see them taking shots and so on and so forth like that. So they affect the kidney. Then we have inherited causes of end-stage kidney disease too. You
Okay.
understand? Apart from all this, then we then other causes can be maybe immunosuppressed diseases such as HIV can also come down with sickle cell disease. That's end-stage kidney disease. People with sickle cell disease also can come down with end-stage kidney disease.
Okay. 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 Are there warning signs that people often ignore?
Yes, yes, yes. There are warning signs because your kidney will not just fail all of a sudden like that in a broad daylight. First, there are signs such as whenever you feel you have decreased urine output.
Mm-hmm.
For instance, when I mean decreased urine output, maybe I go to the restroom 3 times at night, but subsequently I begin to see that I only go to the restroom once at night. You understand? To pass out urine, there is decrease in
Okay.
urine output. I should be sensitive. I should ask my doctor, why am I having decreased urine output? Despite me taking adequate fluid as usual. That's another sign. Then another sign is persistent or recurrent anemia. You go to the hospital, they tell you your blood is short, they keep
Okay.
transfusing you with blood without you knowing the real cause. You should perform a
Okay.
renal function test to know
Okay.
whether your renal function is optimal. So we find out that people with persistent anemia kidney disease can be a cause of it. Those are warning
Okay.
signs for you to know, early warning signs. Then easy fatigability, easy tiredness,
Hmm.
sudden onset of shortness of breath that you might not be able to breathe very well due to accumulation of fluid maybe in your lungs. The kidney is not functioning optimally because you can't urinate out the fluid, so it accumulates to your lungs and things of
Okay.
that nature. So those are signs whereby then facial puffiness. You see someone waking up in the morning, your face is swollen up, your legs are swollen up.
Okay.
Those are
Did you say facial puffiness?
yes, facial swelling, facial
Okay. Okay.
swelling, facial and leg swelling. You wake up early in the morning, you see your face is swollen up, your legs are swollen up. Maybe as
Okay.
time goes on, it regresses by itself again. The next morning again, it swells up again. That means your body cannot take out the whole fluid, so it gets
Okay.
deposited. So those are signs whereby you know that yes, those are early signs that you know that there's something wrong with your kidney.
Okay. Thank you very much, doctor.
You're welcome.
Okay. So who is at the highest risk of developing kidney failure?
highest risk of developing kidney
Kidney
failure
failure.
are,
Yes.
first, if you have a family history of someone who has come down with kidney failure, you
Okay.
should watch out for yourself. You should always have a routine check. You should know what you eat. You should always control maybe your blood pressure. Then, if you're hypertensive,
Hmm.
you are high risk of coming down with kidney failure. You
Okay.
should, or not all hypertensive come down with kidney failure. If
Okay.
you're, if you have well controlled BP, it's you have a low risk of coming down with kidney failure. The moment you know you've been diagnosed hypertensive, ensure you use your medication and ensure you have a BP machine at home to know that okay, it doesn't go higher above normal. You understand? So people who are hypertensive are high risk of having kidney failure. That's if it's not well controlled. Then, if you know you have family history of diabetes or you yourself you're diabetic,
Okay.
so please you are at high risk of coming down with end stage kidney disease. Well controlled
Okay.
sugar level, you will there is a lower risk of coming down with kidney disease.
Okay. Thank you very much, doctor. So,
So,
doctor, kidney disease often progresses quietly. How
yeah.
can Teledoc help people who are concerned about their kidney health or who have abnormal test results?
Now we said early detection saves lives very good. It saves lives and it helps, it goes a long way to progress to maybe the chronic or the end stage kidney disease. You know, as I said, there are stages. It starts with IQ. Normally, some will just come with diarrhea, vomiting, you understand, and then they
Okay.
perform a renal function. They see that their renal function is impaired. So those are
Okay,
people
sorry,
who
sorry to cut you short, doctor. Did you say arenal or urinal?
I mean, renal function.
Oh,
They come
renal,
down with
RENAL. Okay, okay,
yeah.
okay.
So they come down with a renal function that is impaired,
Okay.
maybe as a result of chronic diarrhea, chronic vomiting, persistent vomiting. You understand?
Okay.
So people with such impaired renal function test can quickly, or well, I say with good awareness and with good treatment, once you know the cause, you understand, you address the cause. They need good hydration, what we call super hydration. The moment they hydrate themselves, the renal function picks up back. You understand?
Okay.
So people, so early detection, as I said, it can slow the progression down to that's the end stage kidney failure.
Okay. Thank you very much, doctor. The phone lines are now open. You can call us on 07000 917 917 or 0800 123 5917. You can send a text or WhatsApp message on 08155 917 917 or 07031 756 537. You're tuned in to Women Radio WFM 91.7. You can listen to us on the go via our website at www.wfm917.com or on YouTube at WFM917. Today we are discussing end stage kidney disease and management. If you have questions about kidney disease, dialysis, transplantation, diabetes, hypertension, or kidney health, call in now and speak with our guest doctor. Okay, doctor, once someone reaches end stage kidney disease, what treatment options are available?
Okay, there are different treatment options for end-stage renal disease. We
Okay,
have what we call the conservative management,
okay,
whereby we we control your blood pressure, we manage your sugar level. You understand? Then we do what we call dietary modification. You know, dietary modification, whereby we restrict your fluid intake, we restrict your sodium intake, that's the salt intake.
okay,
Then, yes, then we treat anemia because they come persistently with anemia, low blood level. So we treat so
okay,
those are the conservative management. Then
okay,
The main management, you understand, is hemodialysis. Some will be on dialysis for life. You
Oh,
understand? Be on dialysis for life, whereby an access will be placed on them and they
okay.
will be able to have dialysis. No, dialysis is like, how will I put it, is a machine which is like an external kidney that helps to filter the whole toxins and remove waste
Yes.
product that your kidney cannot do and to remove
Yes.
some fluid.
Mm.
Then some will be on 3 times weekly dialysis, some twice weekly, depending on your kidney function test. Then the main optimal goal for end stage kidney disease is renal transplantation. You understand? But how many people in our country or in Africa can afford a renal transplant? Renal transplant now is about 35 to 40 million for a
Wow.
renal. That's for the procedure, not to talk of the medications you'll be on it for life in order to avoid
Yes.
rejection.
That's a lot.
You have to be on immunosuppressant, which cost a lot. So those are the basic management. Then there are those whereby, of course, conservative management might not work for them,
Okay.
dialysis might not work for them, transplant might not work for them. We call them, then we do a palliative care for them. Those are people
Okay.
who are palliative care. Those are people
Okay.
who maybe they are extremes of age, you understand, or
Mm-hmm.
those who are still in the denial phase, you understand. They don't agree that they will undergo dialysis. They don't agree that they will do a renal transplant. So those you invite the psychologists, you invite the social healthcare workers to talk to them. Then the elderly people, maybe 90, 100 and above, you know that, of course, they cannot withstand the dialysis that much, you understand. So you invite psychologists, you invite social care workers for them.
Okay.
So those are the basic management modalities for end stage kidney disease.
Okay. From the doctor and from we at Women Radio, we are telling you take care of your kidney. Oh. This
Very
is
well.
it is a lot.
So,
A lot. Okay, so doctor, can dialysis cure kidney failure or does it simply replace some kidney functions?
hmm, dialysis cannot cure kidney failure.
Ah,
Dialysis cannot restore kidney function if it has gotten down to end stage kidney disease.
okay.
So as I said, I said end stage is an irreversible kidney failure. You understand? That means
So
it's not,
dialysis is just like helping to push it along.
yes, it's just
Okay.
buying time for you, removing the toxins, removing the the fluid retention in order to avoid some acute complication that you might have, you understand, without doing all this. So the only place whereby dialysis can function to reverse back your renal function is before it gets to the end stage renal failure. There are
Okay.
those who
If
just
it
have,
is still chronic, can dialysis reverse it?
yes, if it is still chronic, not all chronic. Chronic may be stage 1, stage 2. Acute phase whereby the creatinine level is high, that's okay, hyperhydration is not making it go down. We'll tell
Okay.
the person to go on dialysis maybe for 2 or 3 sections. Then you see that the kidney picks up back and continues.
Okay.
So
See,
dialysis does not cure. It only helps to filter out the waste product.
okay. To our listeners, my head is full, it is bubbling with this information that the doctor is passing. End line, take care of yourself. Take care of your kidney. Okay, so doctor, how does kidney transplantation compare with long-term dialysis and who exactly is eligible for a kidney transplant?
Okay. Now everybody is eligible apart from those who have extremes of age, as I said,
Okay?
50 years and above. Then before a kidney transplantation will be done, of course, there must be what we call a workup,
Walk up?
a kidney transplant workup.
Okay.
Kidney transplant workup simply means you bring a donor.
Okay.
You bring a donor, then during During the workup, they will perform some investigations and ensure your donor is a perfect match with yours. So there's what we call grouping and cross match. They cross match the cross match with
Yeah.
between you and your donor and know that okay, it's a perfect match before the renal transplantation can happen. So there are
Okay.
individuals whereby they will bring a donor and that donor is not fit to transplant for them. So of
Okay.
course they will stop at that point and look for another donor. But the best donor will always advise people to avoid acute rejection or to avoid rejection in long run is family members. A family
Okay.
member can donate to you and it's always 80 to 90% a perfect match with you. So we advise people who wants to do a renal transplant to have a family member, siblings, relatives, a good match for renal transplantation. Now, for dialysis, you cannot be on dialysis for life.
Okay.
Dialysis also has its own complications. You understand?
Mm.
Because every day you're on dialysis is not easy. They have what we call electrolyte imbalance. They have what we call muscle cramps, things of that
Mm.
nature. So those are those are the disadvantage of dialysis. But having a renal transplant is an optimal goal for replacement, and you can have back your life. You understand? The only thing is you have to be on medications, the immunosuppressant, to avoid rejection long run.
Okay. Hmm. Like I said earlier on, it's a lot.
A lot.
Can someone live a normal life after receiving a kidney transplant?
Yes, you can live a normal life after receiving a kidney transplant with your medications, as I said. You don't miss
Okay.
medication for 1 day. You don't miss medication for at all. You have, how will I put it? We always tell them you will always have an alarm for it. And you ensure your medications are not counterfeit. They are original drugs. They are
Okay.
the good medications. So you don't miss medications. The moment you adhere to the plans and everything, you will have a good normal life
O-
afterwards.
Okay, so doctor, you said they should anybody with kidney disease should ensure they use their medicine every day, set alarms. But we are humans. Sometimes when we set alarms gone, we don't remember. Sometimes the alarm will just be ringing, you will not remember to use the medicine. If a person misses the medicine for a day or two, does it have any adverse effects?
Yes, it does.
Just a day.
Just a day.
Hmm.
Now, we how will I put it? We are different.
Okay.
Someone might miss his medication for a day and the kidney will still be fine. Another
Okay.
person can miss just a day
Mm-hmm.
and there will be what we call the acute rejection.
Okay.
Now,
Can you explain what acute rejection is?
acute rejection simply means it's an immediate rejection, but that does not
Okay.
mean the body has rejected the kidney automatically.
Okay.
You will be admitted, you will be placed on medications and treat the cause of the acute rejection. And
Okay.
peradventure, it can reverse back and play back its normal function.
Okay. So just I'm clarifying again. You
Okay.
mentioned earlier on, you mentioned anemia, hypertension, and diabetes. So are you saying that anybody who has these three have to watch out for kidney disease? Are they interwoven?
Now, yes, just as I said, they are at higher risk of coming down with kidney disease,
Okay.
hypertension, diabetes, family history. Then, if you know that you take alcohol, you take illicit drugs such as NSAIDs, drugs which
Okay.
are not kidney friendly, you understand?
Okay.
You are at high risk of coming down with kidney disease.
Okay. Hmm. Well, do blood pressure and blood sugar control play a role in protecting the kidneys?
Yes, yes, yes. Now, if you have well controlled blood pressure,
Okay.
you will not overwork your kidney.
Okay.
So, but if your blood pressure is not well controlled, you are overwearing, you are overworking,
The
causing
kidney.
wearing and tearing and scarring of the kidney. So
Okay.
that's what impaired the renal function. Likewise,
Okay.
blood sugar too.
Okay. Can kidney failure be prevented, beg your pardon, in most cases?
Yes, kidney failure can be prevented if
How?
you now the prevention of kidney failure is, as I said, you are at risk of it, have a well BP control, see your
Okay.
cardiologist for routine check, and if there's a
Okay.
need to change your medications. There are those who, okay, they've been diagnosed hypertension. Of course,
Okay.
they will start with a particular drug, but you don't go to the hospital for routine check again, whether there is a need for you to change that particular medication or to add up to the medication. So if you don't do that, it will tilt you to having an impaired renal function. So it
Mm.
can be prevented by you avoiding what can cause it, avoiding toxins, avoiding agbo, avoiding all those illicit drugs, avoid not going to the hospital when you know that okay, you are at the risk of having renal function. You
Okay.
are at risk of having kidney failure.
Okay. Okay. So you mentioned Agbo. So I'm going to pick on that because
Okay.
you said that some of these leaves, the herbs, we don't know their function. And there are some people who actually know the function of these herbs. You know, people actually study conservative
Plants.
medicine and
Yes.
alternative medicine.
Medicine.
So are you saying herbal remedies are capable of damaging the kidney? Or are you saying if they are used in excess or even if they are used for the wrong reason?
Now, in not all herbal, number one,
Okay.
if they are not used as well prescribed. Now,
Okay.
most of us in this side of the country, we don't use the alternative medicine very well.
Mm,
You see people at the park taking one shot, they don't know what the constituents of it,
okay.
they don't know the quality of it,
Okay.
they don't know the particular leaf, but we just want to take because they say, no, I want to perform better today. So
Hmm.
people use it anyhow. People use it to energize themselves. People use it to do so many things. So
Okay.
alternative medicine, of course, is good. Yes, people study plants. People do a lot, which helps because most of our modified drugs too are from plants and leaves.
Okay.
So in which they are good for the body, but
Okay.
too much of it that is not well prescribed or that is not prescribed by a health practitioner, you
Okay.
avoid.
Okay. In the same vein of using medicines that are not prescribed,
Yes.
many Nigerians frequently use painkillers without prescription. And I know many people guilty of this. Ordering for me by painkiller. My hand
Yes.
is paining me, painkiller. My leg is paining me, painkiller. My throat is dry, painkiller. How dangerous is this for kidney health?
So, as I said, most of the end states are, 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 are not kidney friendly. They are
Okay.
what we call nephrotoxic. That means they are toxic
Sorry,
to the
what?
nephrotoxic.
Okay.
That is toxic to the kidney.
Okay.
Now, that's overuse of it,
Okay.
frequent use of it. If you use diclofenac in the right prescription, right
Okay.
dosage, it will not cause any harm.
Okay.
But you use diclofenac, how will I put it, QDS, maybe morning, evening, night, anytime and you use it so much, of course, it's not kidney friendly. There is the amount the kidney can filter such toxins. So as soon as it's too much for the kidney to filter, it
Okay.
causes scarring for the kidney. It destroys the kidney functions.
Okay. Okay. What lifestyle habits help preserve kidney function?
Good lifestyle habits.
Mm-hmm. What's
For
good
instance,
lifestyle habits?
like okay, now we advise you take a lot of water, good water per day. You should have minimum of maybe 2.5 to 3 liters of water daily.
Okay.
You should have good exercise,
Okay.
prevents maybe a risk of hypertension, diabetes. You understand? So if you have all those good lifestyle modification, you reduce the salt intake, which are sodium, so as they will not accumulate, and
Mhm.
so on and so forth. You eat good food.
Okay. Okay. That's do sugary drinks and even seasoning cubes affect the kidney? And how
Uh,
do they affect the kidney?
Sugary drinks.
Sir?
No, you say sugary
Sorry.
drinks.
Yeah, sugary drinks.
Yeah, okay. Sugary drinks does not affect the kidney
Okay.
if you have a good, how will I put it, sugar control. Now, if you
Okay.
are not diabetes, of course, your body can, that's your body, you can take care of the sugar, the
Okay.
carbohydrate. But you are diabetic, you are taking excess sugar, of course, you're causing more harm than good. That means your blood sugar will not be well controlled. So
Okay.
it can tilt to impaired renal function test. Now again, so just as I said, sugar drinks does not affect the kidney, except if
Okay.
you have a risk, which is diabetes, you understand,
Okay.
that can now cause maybe a renal impairment for you.
Okay. Finally, doctor, at what stage should a patient be referred to a nephrologist?
Okay. To me, the moment your renal function is impaired, you go to the hospital, they said your creatinine is above the normal, your urea is
Okay.
above the normal,
Okay.
you should be referred to a nephrologist.
Okay.
At that stage, of course, it can be reversed back.
Okay.
We find out that many people at that stage, they don't go to see a nephrologist. They tend to treat at maybe a primary health care center. It
Okay.
got worsened to the chronic stage, whereby they
Okay.
begin to see the creatinine become severely elevated before running down to see a nephrologist. And that
Okay.
time, maybe probably it might not be reversed again. So I feel whenever you see an impaired renal function, a little, see a nephrologist.
Okay.
Go for follow up.
Okay.
Yeah.
Your final words, doctor, for people who are battling with either end stage kidney disease or chronic kidney disease.
My final word to them is always consult your nephrologist. I know it's a life-threatening situation. It's
Okay.
not easy. It's capital intensive. I've seen people who will tell you that, or patients who will tell you that they've sold everything they have in order to stay alive for this. I know it's not easy. A
Okay.
dialysis session is about 50 to 60,000 per session, and your nephrologist will want you to do 3 times in a week for you to have a good life. Three
Okay.
times in a week, apart from the medications attached to it, the erythropoietin that you need to boost your blood. I know it's not easy, but
Mm.
ensure you see your nephrologist, ensure you do what your outline plan for management.
Okay.
And I pray you'll be fine because it's not easy. Psychologically, mentally, it's draining.
Mm.
Financially, it's draining.
By His grace, we'll be fine. Thank you very much, Dr. Olakunle,
And
for helping us understand. Oh, Adekunle,
yes, ma'am.
I am so sorry
No, no,
about that.
no problem.
Thank you, Dr. Adekunle, for helping us understand end-stage kidney disease and its management. If you'd like to speak privately with a doctor, download the TeleDoc app today. Book a quick 10-minute consultation or a full 30-minute consultation. Choose your preferred time. Upload your medical records. Speak securely through video consultation and receive prescriptions digitally. Thank you for listening. This is still Radio Doctor on Women Radio WFM Nigeria. Sorry, this is still Radio Doctor on Women Radio WFM 91.7, Nigeria's first specialized health program. Broadcast Monday through Friday at 10 a.m. Do have a healthy day. Thank you for joining today, Doctor. Okay, it's been a long morning.
Thank
And
you,
I
ma'am.
hope all our listeners you had things to gain from our conversations this morning because they were wonderful and insightful. Don't forget, it's Old School Thursday. We have lovely music to keep you company. Continue to vibe and jam with us. Good